What's up, you all? This is Dr. Jewel, and welcome to Your Mind Matters with, of course, me and J-Bold. How you doing, J-Bold?
I'm doing okay, Dr. Jewel. How are you?
Oh, man, I'm making it. I'm doing good. My Pims is straight. Okay, I thought you were going to ask me, but I'm going to go ahead and lead out with them, okay? I am physically energized.
Okay.
I'm emotionally happy.
How are you mentally?
Mentally, I'm mentally exhilarated.
Okay.
I know you didn't expect that, did you?
I didn't. That's a lot of syllables.
I know, and I'm spiritually connected.
Okay.
Man, this is a good day.
It's a good
My
day.
Pims, I can make some serious decisions, man. I can do some good things today.
Yes.
With that Pims. This is a good Pims, you all. But some of you may not have a good Pims, but guess what? We're not judging here because we know life ebbs and flows, okay?
Yes.
We just want you to be real with yourself. And when you wake up, we want you to do your vital signs in the morning to make sure that you're okay. So I just wanted to address this for many of you who have reached out to me on, Jonathan, I've been getting messages on instant message.
Yes.
I've been getting messages
Audio
on
messages.
Facebook, audio messages. I want to let you all know, thank you so much for supporting our episodes of Your Mind Matters. You know, coming out the gate, you're just kind of like, woo, are we, God, we want to do this. We feel like you've called us to do this. But I just want to let you know that your encouragement, your support matters so much. So thank you so much from the bottom of my heart. Man, we're going to keep doing this thing until God says stop. We're going to keep doing this, okay? Because the goal is to help the church, okay? We're not excluding anybody, but look, we want you to be mentally, emotionally well, okay? And so today, that leads us into this discussion because, J-Bold, we got to talk about this
We
today.
have to.
All right.
It's often the elephant in the room.
It is the elephant in the room. Everybody has this person in their family. Look, let's just keep it real because that's what happens. We talk about everybody else,
Yes.
but I want you to be like, look, let me deal with me. Mm-hmm. This is one of those me shows, okay?
Yeah.
I mean, you may have other people that you can be like, yeah, now I understand them, but this is a me show, okay? So look. We want to talk about the difference between moody people, and bipolar.
They're two different things.
Of course they are, Jonathan. They are two different things. And you know what? I think this is what's messed me up a little bit because bipolar is like this word that we just throwing out here on these streets
right.
like it's nothing, okay? So, I mean, I will hear in different conversations people just saying, you're so bipolar.
Can we stop that?
Can we please stop that? Okay, put a pause right here. Can we please stop calling people bipolar? Like, that is a real serious mental illness. And so we shouldn't take it lightly.
That's right.
J-Bold, okay, you have bipolar disorder. You made that very clear. How do you feel about people just using the word, you so bipolar? Why you acting bipolar? That was bipolar. How do you feel about that?
It's detrimental. I mean, it really negatively impacts how I feel about my disorder. And it also makes me think, why are we out here diagnosing people in these streets just because that's essentially what you're doing when you say somebody's just acting bipolar, or they are. You're giving them a diagnosis based on your misunderstanding of what a disorder is, how it impacts them, and oftentimes I think we say moody and use them interchangeably because we don't have feeling language. We're not really sure how to express ourselves, and we don't always know our own mood. And we may not have the language to do so we just put a label on it. You're bipolar, because that may be the only way we can describe someone whose mood may ebb and flow, which is normal.
Oh, so it's a language deficit.
I think so.
Yeah, I think that's good. That's real smart, J-Bald. So you know what? Let's talk about these feeling deficits, because the thing is that, okay, so our mood's bad because we want to talk about moodiness, moods, and because all of us know people that are moody.
That's right.
Man, sometimes we are moody.
I
if
mean,
we
depending
just
on
own
the situation.
Come on. Depending on the situation, your moods can ebb and flow.
That's right.
And that's like a natural part of life, okay?
Yes.
But how do you know, like, okay, but let's just back this up a little bit, because sometimes moody people can be very challenging people to deal with. Now, personally, J-Bold, let's just keep it real, okay? Personally, I know I'm supposed to love everyone. You know, church, you're supposed to love everybody, be forgiving, you know, supposed to do all the things, okay? Long-suffering, compassionate, kind, all the things, okay? I know that, okay? So you don't have to spiritualize that, but I'm going to tell you one thing. Let's just set the record straight. Moody people are some challenging people to deal with. Would you not agree?
I would agree.
Yeah, because moody, one thing about moody people, J-Bo, you don't know how they're going to show up.
Ever.
Ever. Okay? So, you know, you may talk to them 1 hour and they're fine. They are sensible, you know, responding like they have some kind of emotional intelligence. Oh, I said something. We're going to have to talk about that too.
Oh, yeah, that's part two.
Yeah, that's another show. That may be the next one. Okay, but anyway, you know, and then the next time, within 30 minutes, they are 25, they've gone from 0 to 25 or 200, okay? They are irritable, angry, mad, screaming, hollering. I mean, totally emotionally unregulated. And so we got to realize that people are going to have different moods. Look, okay, so for example, when you have a bad day at work, okay, how does that usually affect you? Like, how does that deal with your mood?
Mostly I'm sad.
Okay.
I could be angry, just depending on what happens.
Absolutely.
If I had an evaluation that I didn't agree with, or a partner that I'm dealing with that's very difficult to manage, or it could just be, you know what, personally I had a bad day and I'm bringing that into my work environment and I'm not able to regulate the two or differentiate between the two often.
Absolutely. And so, but you know, a bad day at work can mess with your mood. So you come home, you're exhausted, your temper may be a little shorter, your words may be a little bit more, you may have words or they may be a little sharper, okay? You may be isolated. You know, you just may want to just get away. And so some people can look at that as like you're moody, or they may be talkative and they want to talk to you because they've come off of work and they want to talk about it and you really don't want to talk about it. Or you seem a little bit more dismissive of them, or you start finding a little bit more fault than you normally. You come in, you know, you're in a bad mood, okay? You come in, why isn't this done? Pick up your stuff, you know, you're going off. And so that's mood. Mood is, and so I think what I want to share is that moods are normal.
That's right.
Moods are the normal color and canvas of your life.
Yes.
You have the right to have different moods. You don't have to stay. That's why moods are real. They, you know, if someone passes in your family, you lose a loved one, you may have a depressed mood, okay?
You're
sad,
grieving,
crying, okay? You may be joyful one minute and then you start thinking that thing brings back a memory and you may start crying. Or you may have had something serious happen in your life and you don't really react, and then maybe a month later you break down and your mood starts changing after you start processing that loss or that incident or something that happened, that traumatic event. So your mood starts shifting. So I guess I just, you know, J-Bold, I don't want us to dismiss the fact that moods are a normal part of your mental state.
It's a part of the human experience.
Absolutely. They are a part of the human experience. And so when someone changes their mood, or if mood changes, usually with a normal person, you know, who's healthy, moods change as a direct result of something that has happened. Okay, so I want us to remember that. Usually when, if you have some mood fluctuations in a normal person that's processing in a healthy mental way, your mood is directly related to a catalyst, and something happened, okay? And as a result of that, that mood starts changing, okay? So that's healthy. So I don't want us to mess that up. People can look at David in the Bible. Come on. I mean, if you want to take and go spiritual and go in the Bible, David had times where he was high praise, okay? He's praising. He's dancing before the Lord. And then there were times where if you look through the Psalms, David was like, overwhelmed. I mean, was sad, lamenting, before the Lord, And so the thing is that highs and lows. Was David moody? No, David was responding to life, okay?
Yes, he was on the run.
Come on.
He lost a family member. His kids were acting up.
Coming for him, trying to kill him. I mean, so that's life. It is going to ebb and flow. Jesus, they were like, did Jesus have a bad mood when he turned over the tables in the temple?
He was responding to the fact that he saw some things going on in the temple that should not have been.
That's right.
And they were out of control. And he felt like, you know what, this is not what the house of the Lord is supposed to be about. And I've got to do something about it.
That's right. So he flipped over the tables. They could have been like, Jesus had a bad day.
Yeah.
No, he did have a bad day. He was livid as to what was going on in the house of God. He was livid, So the thing is that he was like, y'all thieving up in here. Like, what are y'all doing?
Right.
And so he turned them over. So again, moods change in direct response, whether it's biblical, you want to spiritualize it, because some people make you think that if you have different moods that, what's wrong with you? You have to keep this consistent state of whatever it is that they've measured, to make you feel like, you have to stay here all the time. No, you ebb and flow because you have the right to have different moods, but that does not make you bipolar. Let's talk about this term, the elephant in the room, that people are throwing out this term bipolar. Another one that they're throwing out is schizophrenic. Okay, so we got to talk about that. That's so schizophrenic. Like, what does that mean?
What does it mean?
What does that mean? But I want to go back to bipolar because that's when you're dealing with moods.
Yes.
So J-Bold, come on, let's take the sting out of this word bipolar. Let's talk about it, hit it head on, so that really people can be empowered, because really you need to know, I need to know, if we're actually experiencing just normal fluctuations in mood, or if we really may have some symptoms of bipolar disorder, which is actually a mental illness. So let's talk about bipolar. Let's just pull back the onion on this.
So
let's
I have
talk
a
about
definition.
Come on with the definition, J-Bold.
So according to the APA, just a general definition of bipolar disorder is a serious mental illness in which common emotions become intensely and often unpredictably magnified. Individuals with bipolar disorder can quickly swing from extremes of happiness, energy, and clarity to sadness, fatigue, and confusion. These shifts can be so devastating that individuals may consider suicide. Now, all people with bipolar disorder have manic episodes, which are abnormally elevated or irritable moods that last at least a week and impair functioning, but not all become depressed. So the moods are so severe that they're beginning to negatively impact your activities of daily living, your way of being, and ways of operating as a human. Not just, you know what, I had a bad day, or I had a really good day and I'm on cloud 9.
Right, absolutely. And because some people may be like, when you're on it, when things are happening really well and you're just really excited and elated and you're in this happy, joyful mood, and you're like, I'm going to go and take everybody out to dinner and all of that, they're like, whoa, what happened? You were here, now but you had something. You may have gotten a promotion.
Yes.
Something happened that you want to celebrate in life, and so you may have an elated mood. But the difference that you said when you're dealing with bipolar, and let's just deal with it right here, is the fact that bipolar disorder, when you have a mental illness that hits your mood, is something that you really can't control.
Yeah.
Okay? You have certain moods regardless of what's happening. Okay? And so I think that that's something that we have to kind of hone into as we deal with this mental illness. First of
Yes.
all, it is a mental illness.
That's
Okay,
right.
so let's just take that off the table.
Mhm.
Bipolar disorder is a mental illness.
Which
Okay,
means it's diagnosable.
it is diagnosable in the mental health Bible. Okay, DSM-5. Okay, it
Yeah.
is in there. It is a mental health. It's a mental illness. Okay, and so we have to treat it as such. But the question becomes, J-Bold, I think that what people get mixed up with is, what's the difference between just being a moody person and actually having bipolar disorder? Okay, and so I think that's what we have to kind of shift through. Okay,
Mhm.
so again, bipolar disorder is a mood shift, okay, that oftentimes is not dependent on a life event.
That's
Okay,
right.
so I want to kind of go back and kind of talk to you about your experience with bipolar disorder, because I'm hoping that as we start talking about it, that other people can say, huh, and start kind of processing through their moods. Because the thing is that we have to start, when you're dealing with mental health, it is something wherein you have to start kind of logging and journaling your emotions, your mental health. You've got to start saying, I'm not sleeping today. I only slept 3 hours Monday. I only slept 2 hours Tuesday. I slept 3 hours Wednesday. Okay? We're going to have to slow down in life and realize that our mental health matters, and we're going to have to start kind of being a little bit more in tune with it
Yeah.
than just flippantly just saying, well, that's just who I am. No, there actually may be an issue. It's no different than a lump growing on my hand
Yeah.
and me looking at it and saying, it'll go away. Let me tell you something about bipolar disorder. Bipolar disorder is not going to go away.
That's right.
It's just not going to
That's
go
right.
away, okay? If anything, it will continue to present itself, presenting more challenges in your life, okay? And so if you try to spiritualize it, okay, and I don't have that, the devil is a lie. You know how many the devil is a lie I hear when I'm diagnosing people with physical illness. I'm showing them numbers and levels, and they're like, the devil is a lie. And they do the same thing with mental health conditions, okay?
Yes.
The devil is a lie, okay? But the moral story is this: we are people, we are human, we are broken mentally, emotionally, spiritually, except for Jesus, and physically. We're going to break down.
That's
We are
right.
not perfect. Things are not going to be perfect in us, okay? And so the moral story is that mental health is no different. You can have a disease of the mind, just like you can have a disease of the body. And people are like, well, kids born, they have, abnormalities. They have genetic conditions. You are born with these. Well, there are conditions you are born with. It's in your DNA. It may manifest at certain ages, but then when you have different diseases, we can understand autism spectrum disorder,
Yes.
ADHD, these are developmental disorders. So things can come with you as a part of you just being a broken human. That's what that's who we are. But there's treatment for that. So I think when we go to bipolar disorder, mood disorders, sometimes we kind of gloss over them because we just attribute them to, that's your personality.
Yes.
You're just being extra. You know what I mean? You just, oh my gosh, you're over the top.
Yeah.
or when you're actually having a mood disorder and you're manic, you throw the bomb parties. Okay, your parties are off the chain. I've heard a lot of people when they don't even want me to, I promise you, they are diagnosed bipolar.
Yeah.
They don't even want me to help them with it because they are their most creative.
Most productive.
They're most productive. Their artistic creativity is off the chain during this time. They don't sleep. They get the most done. And so they're like, no. I don't want to come up off of that. Let me go through and let it crash. And then they crash and burn.
Yeah.
Okay. So I want to talk about what are some of the symptoms? What are some of the things you need to look like? If you're like, my moodiness is a little bit excessive. It kind of is throwing off my family, my work life, how I interact and gauge things sometimes. How do I know that I'm not moody and may need to look at bipolar disorder? So I'm going to throw it to you. You tell me, what are some of the things that you experience early on that parents can look for, that you can kind of talk to us about it, your experience?
So I think I had a traumatic event that occurred that may have been the onset of what grew into me being diagnosed as bipolar. One thing I will say, there were periods of time where I was responding to auditory stimuli that wasn't really there. I was hearing voices, and those voices were telling me to do some serious things about hurting myself or hurting others. There were periods of time where I was actually acting out, and what that looked like was me harming my mom, harming my brother, through various violent acts. And that was because I had several flooding thoughts. Those flooding thoughts were telling me to do certain things on down to up to growing into adulthood, really going on spending sprees, and that negatively impacting my credit and also my bank account, because I would just click, spend, spend, go, and then I'm spending as well because I'm not only spending, but there are periods of time where my coworkers would be like, "Oh my gosh, you are just so amazing, and what is happening?" The energy that I was giving off was infectious, but they would notice the shift in that I would be very happy, joyful, jubilant, and then the next moment, within the next hour, I might not be as jovial. I might just be in a depressed mood, and that would be an onset of the depression side of it coming on. And when that would look like me not bathing, oftentimes not washing my clothes, not washing my dishes, and things would just kind of be in flux. And there was a moment where I even felt like, you know what? I'm going to streak down the street. I'm with a butcher knife, and I got scared. Like, wait a minute.
Right. Absolutely.
I bought a car, and I couldn't get that thought out of my mind. Go buy a car. I need a car. I did not need a car.
Right.
But I felt like, you know what? I can't get this thought out of my mind. I'm going to just go do it. And usually I consult you or your husband, and we have a conversation about it, and we sit down and look at my financials and say, is this the best decision? But in this instance, I just went to the dealership, and I didn't even really think about what I was signing as much as, boom, I want this car. We're going to get it. The thing about me was I was in a role where I had enough funds to cover it.
Yeah.
And so I wasn't looking at my spending sprees as spending sprees because I actually had a salary that could
had a cushion for it.
Had a cushion for it.
Right, absolutely.
And I could have glossed over it, but then when I think about it, I would get in debt, get out of debt. I would go from periods of, you know what, I'm going to go to law school, and I'm going to become a lawyer, and then I'm going to go to medical school, and then actually, no, I want to be a psych nurse practitioner, so I'm going to go to nursing school, and then I'd go through the process of applying and because I can write and I can test a little bit well, I could get into a program and then try to start it, and I wouldn't realize, okay, then it would hit me the magnitude of the decision that I was making. And I wasn't able to regulate at all. I could not stop. I couldn't turn the thoughts off. I couldn't just go to sleep and sleep it away. There were periods of that I didn't want to sleep. I didn't have to. I felt like, you know what? I've got enough rest for today. I'm going to just go on about my day and be just fine. So there were periods where I had these grandiose moments. There were periods where I had these spending sprees. There were also periods of psychosis, of hearing voices that weren't there, of seeing things that weren't there. And it was very scary. And it all came to a head when I had to be hospitalized. And I could not function at work. I couldn't function at home. I was it's kind of hard to talk about because I'm sharing, and I haven't actually shared this before. So it's hard to explain your journey when you haven't had to discuss.
Absolutely.
Yeah.
It's a lot. I mean,
It's a lot.
It's a lot to unpack, and of course, we just can't. Thank you for sharing it.
Yeah.
I mean, that's a lot. You've made yourself very vulnerable, but I also want to encourage you because there is life with bipolar.
There is life.
There's life.
Absolutely.
There's fullness of life with bipolar and disorder. And so the thing is that just for people to identify it is the first step. Okay,
Yes,
because
that's step one.
you may go through decades and not realize that I struggled with this as a late teen,
That's right.
as a young adult,
That's
and
right.
no one caught it, okay? Because they just kind of rationalize, oh, they're just impulsive, or they're just being young, or they're just being, that's just what young people do.
Yeah.
Or, we kind of...
Or if you're in a really spiritual family that spiritualizes a lot, it may be, you know what, you're just possessed. You are under demonic oppression.
That's right.
And we've got to exorcise it out of you, or we can go to church enough. And if you just go to church
Get on
and
that altar.
pray,
Fast.
go to the altar,
That's right.
fast, read these scriptures,
That's
give
right.
you this prescriptive kind of walk, if you
There
will,
you go.
of all the spiritual disciplines. And if you do everything 100% of the time, you're going to be fine.
That's right. You're going to be freed from this demon.
Yes.
When really it could actually... it's actually, a physiological issue with the brain, okay? And the way you process and the way your brain processes, okay?
That's right.
And so I want to talk about bipolar disorder because some of you may be like, whoa, I can kind of relate to some of the things that Jonathan has just mentioned. Man, whoa, I've done that. And so let's talk a little bit about what bipolar disorder can look at. And then we won't unpack it all today. We're going to keep this conversation going because I have guests that are going to come on the show to talk about their journeys with bipolar disorder, what it looks like. We're going to talk about the medications, what has worked for them, what hasn't, therapy. We're going to do all the things because we've got to peel back this layer by layer. But I don't want to leave this show today without talking a little bit about bipolar disorder and what to look for.
That's right.
Okay? What to look for. It is not a normal fluctuation in mood based on situation, okay? Like Jonathan said, certain things can kind of cause it, certain stressors sometimes can be the catalyst for us seeing the symptoms of bipolar disorder. But let's get into them, okay? Because you brought up some of them. So I'm coming here from my psych Bible here. I talk about it, y'all, DSM-5, all right? So we want to talk about manic episodes, okay?
Yes.
Because one thing about bipolar disorder that kind of distinctly separates it from other mental illnesses is the manic episode, okay? So let's talk about mania. So, sometimes I ask my patients, are you manic? They like, they'll let me know I was manic. Well, what does mania really mean? And so mania really is a distinct period, and this is just a definition of abnormally and persistently elevated, expansive, or irritable mood, and abnormally and persistently increased activity or energy lasting at least 1 week.
1 week.
Okay, 1 week. All right. But if you're hospitalized for it, it doesn't matter the length of time, okay? It can happen one day. If we have to admit you to the hospital for this expansive, irritable, then, bipolar, you're manic, okay? So let's talk about mania, and then you can kind of help me to flesh this out a little bit. Okay, so inflated self-esteem or grandiosity, okay? So during the period of mania, you may have increased energy or activity. Okay, so if you have like 3 or 4, a minimum of 3 of these, okay, I want you to, we got to start getting some help. Need to start looking at maybe it's not moody, maybe this is bipolar. Okay, so out of the blue, you start experiencing one of these, inflated self-esteem or grandiosity. So what does that mean? That means, like you said, I'm running for president. Okay, I had a patient who was like, I'm running for president.
Yes.
Okay. And I'm like, whoa, what's your platform? And she gave me her entire platform. Okay. It was quite something to see. But again, that grandiosity, how about you? Any thoughts about grandiosity? Increased self-esteem. Like you said, I'm going to law school.
Yeah.
I'm going to medical school.
All at the same time.
All at the same time. I'm going to start I am going to be an influencer, and I'm going to make $1 million, and I'm going to start, and you start this excessive spending. I'm just going to buy all of these things. You know why? This $3,000 Gucci purse, I'm going to purchase it. I'm not going to pay my bills because I'm going to go ahead and start this podcast. I'm going to be an influencer. And I'm going to make $1 million and all that. All that comes together. And it's this inflated idea of who I can rule the world. Okay? I can rule the world. So you start feeling a elevated sense of I'm super, kids may be like, I'm Superman. Now, some of it is play. So, but some of it is like, whoa, and then they're running and jumping and hurting themselves. And you're like, wait a minute. We kind of like need to tease that out a little bit, okay?
Yes.
And sometimes you can't always do it, but I want you to look for these things. So inflated self-esteem of who you are, you may be a banker. I can be the CEO of this, I am going to be on a fast track. I'm C-suite material. All of a sudden, this inflated sense of who you are, who you can be. Nothing wrong with positive self-esteem, but this thing comes on like a Mack truck, okay? It's a manic episode, all right? Now, another thing is decreased need for sleep. This is one of the major things with mood disorders. I need you to know this. That decreased need for sleep. So if you are only sleeping like 2-3 hours, okay, a night, all right, and you're doing that for several days, and this is something that you kind of, you're like, whoa, and you don't even need to sleep. Okay, you get up, energized, you feel good. Okay, you're like, woo, and you only need like 2 or 3 hours of sleep a night. There's a possibility that you could be experiencing mania. Okay. All right. So I want you to think about that. More talkative than usual or pressure to keep talking. I don't know if you've experienced this, but I've seen it. That person with mania, they just keep talking. They just keep talking. Everything. It's just a constant. Thoughts are flooding. They are just talking. They are all over the place. They become extremely, extremely talkative. Okay. And it's a pressure to keep talking. They don't stop. Okay. Yeah. You just keep going, and you're like, what is going on? And they just keep talking, okay? So that's something that you may see. Flight of ideas, okay, or subjective experience, or, thoughts that are racing. You talked about that. What does that feel like for you? Like flooding thoughts, like thoughts racing. Did you ever, were you able to shut off your brain? Were you always thinking?
Goodness. I could not shut my brain off at all. And because I'm a researcher too, I would everything time I thought about something, I'd research it. And that would continue feeding those thoughts that were coming. And it I always felt kind of energized and irritable at the same time,
Wow.
if you will.
Yeah. Yeah.
If you will. I know that can be kind of hard to say, but the two kind of works hand in hand for me.
Okay.
And I could not shut my brain off. And I couldn't sleep because I couldn't shut my
Shut your brain
off.
off. That's right. That's right. Absolutely. Absolutely. That's definitely something that you see. Distractibility. That's something else that we see as well. You know, like for example, I've known people with bipolar disorder that like they'll say, Jonathan, oh man, it's a great shirt. Whoa, this light is bright. Whoa, did you see that about Color? Everything distracts them. Oh, the music is loud. Whoa, who is sunny and shiny out here? I mean, it is distractibility. Very easily distracted, okay? Increase in goal directed activity, either socially, at work or school, or sexually. Sometimes you will see, and we don't want to talk about this because we're dealing with the church, but I'm just saying, sometimes you will experience, it's hypersexuality.
Yeah.
Okay, you want to experiment. You want to go have sex with multiple people. You are calling that dude up or that girl up that you haven't seen her in 3 years, and you are like trying to. I mean, you're on a, you know, your sexual appetite just increases significantly. You may find yourself out here. Experimenting sexually in ways. You may binge drugs. You may just get high. That is your thing. You just go on this get high sex binge. It's just out of control, okay? And you may see people have these wild parties that last for days where they're sex and drug. They may be manic, okay?
Maybe.
And so those are some of the things that you can look for, you know, as well. Even at work, again, this elevated sense, you may work 24/7. I mean, you just on it. I gotta do it. You know, I mean, you get this energy, this focus, and you're like, oh, you may say, look, John, this is another thing I see. I'm going to clean my whole house, the neighbor's house. I am going to put all of my shoes in boxes, and you have all this massive shoe boxes everywhere, and everything is organized. You know, you're cleaning, you're doing things excessively, okay? And so that is something that you may want to look at as well, okay? And excessive involvement in activities that have a high potential for painful consequences. So, like you said, buying frenzies. I know people that buy stuff. I mean, they may buy 100 action figures. They may buy 50 pair of shoes. They just go on these, I'm going to go on a vacation. I'm going to this. And again, not paying attention to the financial repercussions of it. They just buy. Some people go into Walmart. I'm going to buy all of the pots, you know, by Rachel Ray. I'm going to do it. I mean, I've seen it with so many different things. So again, something to think about. You may make a foolish investment. Okay, so yours may be a little bit more, you know, you may say, you know, so you're making some really crazy investments. You're not researching it. You're not thinking about it. You're just being very, very impulsive. Okay, I'm going to buy this stock. It's going to go through the ceiling. And you're just making some very, very different decisions. Okay, so the reason why, and look, these disturbances not only affect you, it affects your family. It affects your work. It affects everything around you. So one thing, again, if you don't get anything from this, I want to bring about this manic episodes, mania, because mania is one of the key features of bipolar disorder.
Yes.
So if any of these, and I will say, if any of these things that I discuss, and they can look so many different ways, you know, mania, it has to last 7 days. Or if you're hospitalized because you can't regulate your mood, it doesn't matter, okay? It's mania, all right? Or you can have what we call hypomania, which are the same symptoms. They only last 4 days, okay? And they may not be as intense as mania. So you're able to go to work, go about your life, but you're still having some issues in this area. It's not enough to totally shut you down, okay, and to render you not able to work, have relationships, involve yourself in community events. You're just having these symptoms. They're just not to the point where they totally derail you, all right? If this is you, okay, please go check it out, okay? Go to a mental health provider. Go to your doctor and say, I heard Dr. Jewel that talk about mania, all right, and mood. And I realized that my mood isn't just a normal response. My mood sometimes over a 7-day period, I crash, I do some I wow, like my kids say, man, I wow out, okay, over that period of time. And then after that, I'm good. I come back, I regulate. Some of you may say after I wow out, I get really depressed and go to a low, okay? And so because bipolar disorder deals with mood, it deals with mood fluctuations, high and then low, okay? And so the lows are depression, all right? And so one part of being bipolar is that you have to have experience in high, but sometimes you may also experience the lows. So if you're depressed, you all, okay, if you have depressed mood, if you have a loss of interest in the things that normally bring you pleasure, okay, if you're losing weight, okay, because you're not eating, you're not bathing, all right, you're not taking care of your home, dishes piling up, you're isolating, okay, you just loss of energy, loss of will. If then that bipolar, that's one pole high and the other pole low, okay? Not everybody with bipolar disorder has the lows, but everybody will have the mania or the hypomania, okay? So I want you to take a pause. Think about it. If that is you, I want you to get some help. So I put down here something for you to do. Okay, I'm going to leave you with some homework, J-Bold, and I put it on here. This is what I want you to do. If you're like, Dr. Jewel, I'm kind of like I'm on the fence with this, then I want you to know that keep a mood journal. Keep a mood journal, all right? And document what your moods are. And if they're a little bit sus, like my kids say, a little suspect, all right, I want you to go and get it checked, all right? So look, that's all I have. We're going to continue this conversation on bipolar disorder, mood disorders, all of the things, because the goal here is for you to be mentally and emotionally well, okay? Because you know what? Your mind matters. J-Bold, thank you so much for sharing with us your journey. We're going to continue to talk about it so that we can help. We're praying that we're going to be healed healers, all right? That's the goal. And if you want to share something with us, your experience, man, reach out to us. We'd love to have you on the show because the goal is for us to help each other, all right? So look, you all, peace. Hope this helps.